Hi everybody, this is Matt. This is the last in a four-part series on the heart valves. And today we're speaking about the aortic valve. The aortic valve plays a super important role because it is the last stop before oxygenated blood leaves the left ventricle and goes to nourish every cell of your body. And that's important. It also plays an important role because when it's closed, the filling takes place of the coronary arteries. And I'd like to thank at this time the Society of Thoracic Surgeons for the following diagram, which I got from their website. And again, I thank them for the use of it. And it's a wonderful depiction of the orientation of the aortic valve to the other heart valves and also to the opening of the coronary arteries. If you look carefully here, you'll be able to see open at this point the aortic valve, and above it is the pulmonic valve, and noted also with arrows in the open aortic valve leaflets two circles to the right and left. Those are the openings to the right coronary artery and the left main artery. Below the aortic valve, you'll see both the mitral valve and the tricuspid valve. And I'll bring this up a little further. And you can see clearly here the aortic valve is closed. Again, noted are the openings to the left main artery and the right coronary artery along the edge of the aortic valve, proximal to the leaflets. Above, again, is the pulmonary valve, and beneath the aortic valve is the tricuspid valve and the mitral valve. So the aortic valve is incredibly important, as I said. Very important to note is that its work gets very difficult when either you have high blood pressure, because that makes it more difficult for the leaflets to open, and also important to note is that it's prone to infection. So two things of note is that if your blood pressure is high, get it down, either through diet and control of your blood pressure through exercise and or medication. Because if the systemic blood pressure is elevated, it makes it more difficult for the left ventricle to pump the blood out of the heart with its wonderful oxygen that is going to nourish your cells and get it through the aortic valve out to the body. So if you do keep your blood pressure normal, then it is much easier for the leaflets, the three leaflets of the aortic valve, to open and permit the blood to flow out of the left ventricle and out to your body. It's a big deal. So your blood pressure, again, is incredibly important, and you need to keep it as close to normal as possible. The other issue with infection, if you have an infection in your body, whatever it may be your skin, it may be your lungs, it may be a number of things, you need to get infections treated. The leaflets of heart valves, and especially the aortic valve, are prone to getting infected. They can have buildup of infected cells on the leaflets. The aortic valve leaflets are, again, the last stop before you send blood out to your body. If there are vegetations, as they're called, on the aortic valve leaflets, they can come loose. If they come loose, we don't know where they're going to go to, but some of the places they can go to, and the most dangerous place they could go to is your brain. It could cause a stroke. But they could go elsewhere and cause an infarction of your kidneys or block vessels, pretty much anywhere in your body. So very important is, number one, keep your blood pressure normal. And number two, for the sake of your aortic valve, which is very important to you, you want to treat any infection you have in your body to prevent this type of dangerous scenario where there are vegetations on your aortic valve and you're risking having damage to any vessel of your body when that vegetation or parts of it break free and float under high pressure out to your body. So I'd also like to thank the Mayo Clinic again for their photographs, some pathology photographs, which really depict, and these are wonderful, it depicts the abnormal nature of the aortic valve. So we're going to look here, and these are just unique documentations of valve disease of the aortic valve. So you want to note here that aortic valve A has 2 leaflets. That is abnormal, but not terribly uncommon, and that is these are all calcified aortic valves. Depiction B is calcification of the aortic valve, and if I'm not mistaken, that's in rheumatic heart disease. Depiction C is an elderly person, 80 years old, and the calcification of their aortic valve. And D is a very unusual scenario where there is 1 leaflet. There is, and that causes a great deal of trouble. Also, in regards to the left ventricle and the difficulty to pump the blood through an aortic valve that only has 1 leaflet. So very important, again, is that the aortic valve plays a crucial role in the whole cardiopulmonary circulation. If you're born with an abnormal aortic valve, which you may not discover until later in life, or it may not be discovered at all, it makes your heart potentially work harder, and it may potentially be at higher risk for infection. Very important also is to be aware that you need to keep your blood pressure normal and fight infection whenever you have one to prevent potential increased workload of the heart to pump against increased blood pressures and make the work of opening the aortic valve leaflets harder, and to prevent the buildup of vegetations on the aortic valve leaflets, which is potentially a problem with emboli or particles going off the leaflets and potentially causing a stroke or other damage to your body. So lastly, I'd like to thank, again, the people at the Mayo Clinic of Cardiology textbook, and I would like to recognize their work in this important area. And this is a research study that was published in April of this year, so it's very recent. This is about the repair of the bicuspid aortic valve, a viable alternative to replacement with a bioprosthesis. So this is the article, and as I said before, if you're the type who likes to delve into more detail about these topics, then these research papers are wonderful ways to do that. So that